We're at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association. I'm your host, Rich Helppie, from the Common Bridge podcast and Substack. And with me now is Monique Stanton. Monique is the president and chief executive officer of the Michigan League for Public Policy. Monique, thanks so much for sitting down with us today.
Great, thanks so much for having me.
So tell us a little bit, what is the Michigan League for Public Policy?
Sure, so the Michigan League, we've been around for over a century, serving Michigan since 1912, and we are focused on addressing issues of economic and racial justice in Michigan. So when we think about many of the major policy changes over the last century plus, the League has been leading the charge on many advances or engaged in some of these really important policy fights, including making sure that people have access to high quality and affordable health care.
As you've been traveling through the conference today, sounds like healthcare is huge.
Yeah, healthcare is number one issue for Michiganders. People are scared right now. They don't know where they're really struggling to make ends meet, and healthcare is an important part of that conversation. We're deeply concerned at the League about some of the changes related to Medicaid and the marketplace, and making sure that individuals have access to quality care.
That was great. So talk about some of the things you're working on, and where you're running into roadblocks or where you're making some progress.
Right now, so Medicaid is an essential part, a foundational part of Michigan's healthcare delivery system. Between 2.5 and 2.6 million Michiganders rely on Medicaid in order to access their health care. And so we know with the changes of the One Big Beautiful Bill, H.R. 1, some of these massive rollbacks will mean that people will have less access to care. And we are expecting anywhere between 200 and 250,000 people to lose health care coverage in Michigan, and that is a deep, deep concern to the League and to Protect My Care, the coalition that's focused on healthcare in Michigan.
And they're losing their care because the income requirements have changed?
No, so actually the income requirements have not changed. It's roughly 138% of the federal poverty level. What's happening next year are there a significant number of changes that are going to go into effect, and that will make it more difficult for people to access Medicaid. So things like work requirements, things like twice-a-year eligibility checks, and often what that means is that there's more paperwork in order to make sure that you're compliant. And people have a lot going on in their lives, and it's really difficult to continue to access some of that care with all of these potential changes that are going on.
Indeed, we've talked about this on the Common Bridge, that if you have someone trying to bolt together a life and they're trying to make ends meet, yet have to twice a year go and do a lot of bureaucratic exercise, probably going to put it off until they actually go to the ER or go into a hospital, and then they're presenting as uninsured, and then they have to become eligible for Medicaid. So I see trying to smooth the process for access to Medicaid is a thing you're working on.
One of the core things that we're doing. We're also wanting to make sure that people have a message right now that the eligibility for Medicaid is not changing in 2026. Some of these things will go into effect in October, specifically access to care for immigrants, and then more restrictions will start taking place in January. But for right now, the message needs to be that individuals still can qualify for Medicaid. The work requirement piece has not gone into effect, and so they should be doing everything that they can to get covered immediately. We're also deeply concerned, so we hear, especially in rural Michigan, around access to care issues. And so if an organization or a provider closes or ends a delivery service because there's just not enough beneficiaries, there's not enough covered patients, that medical service is now not available for everybody in that community. And so while somebody might say, why should I care about this? I don't rely on Medicaid necessarily to access my care, but your friend or neighbor does, or the person that's bagging groceries at the grocery store does. And when they lose care, that really makes it a riskier environment for everybody in the community.
And even if they keep on Medicaid, if it's goes from being a 40-minute drive to a 2.5-hour drive, right. That's a big deal.
That's a big deal. And that's a big deal for everybody. So let's say the labor and delivery unit closes in an area. That closes for not just Medicaid recipients, but that closes for everybody in that community. If your behavioral health clinic closes and you now have to drive an hour and a half for a counseling appointment versus 20, 30 minutes, you're less likely to get that care. And we know that people need care in their community. It's just an essential piece in order to stay healthy, to be able to participate in the workforce, to be able to be a caregiver in your community. We need people to have access to that.
And indeed, that would run counter to other government policies, like the VA is allowing more care to be delivered closer to residents through non-VA facilities, and more mental health coverage is being delivered by telemedicine, which is the most convenient form. There's no commuting involved, provided someone has a device that they can do that. How have the hospitals as partners been for you at the Michigan League for Public Policy?
The Michigan Health and Hospital Association, hospitals have been strong partners in the fight for Medicaid and in the fight to make sure that people have access to health care. We realize that they're community-based partners, they're community leaders, they're trusted messengers, the doctors, the nurses, and the individuals providing care. Hospitals are also a core part of community. They're a key employer in many communities. Healthcare are some of the fastest growing jobs in our state. So they are an important voice and a trusted messenger, and we've been really grateful for that partnership.
That is great. What message would you like the audience for this recording receive from you?
So healthcare is essential. Medicaid is essential. We need to do everything that we can do to protect healthcare access as well as Medicaid coverage. And it's important to recognize that if Medicaid coverage goes away, that impacts everybody in a community. And so we want to do everything that we can to help support Medicaid. So for instance, in Michigan, when we expanded Medicaid through Healthy Michigan, hospitals specifically saw uncompensated care go down by 50%. That's massive. That is a clear public policy change that had real benefit in our community. We also saw that patients that were getting treated in the emergency department because they had diabetes or other chronic health conditions that they weren't getting regular care for, they saw that care shift to primary care. And so people were getting healthier. These are really positive things that make meaningful change in people's lives, and we need to make sure that we're doing everything we can to protect it and expand healthcare access right now.
Well, I hope that we can get the word out on that. And is there a way that people that are so inclined could support the Michigan League for Public Policy?
So you can visit our website. If you have questions about healthcare policy, data, visit our website, mlpp.org. You can also visit protectmycare.org, which is our coalition focused on protecting Medicaid in Michigan.
Great. Any final comments for the audience?
Again, healthcare is essential. Everybody needs it. Whether it's for vaccinations, whether it's for primary care checkup, whether it's for something like a stroke or a heart attack or covering chronic conditions, and we want to make sure that people have access to care when they need it and early as well, so people aren't delaying the care that they need.
Thank you so much. We've been talking with Monique Stanton, the President and Chief Executive of the Michigan League for Public Policy, on behalf of the Michigan Health and Hospital Association. This is Rich Helppie, your host of the Common Bridge podcast and Substack, signing off.